program we call IFMCP. So really happy to have you on today, Daniel. Thank you so much for being here.
Of course, Andrew. Thank you so much for having me today.
And as this webinar, we've done this for about a year now. So this is probably like our 1 year anniversary. We've started to expand into kind of more of a global sense webinar. I think you're definitely our first guest from Switzerland. You're currently outside of Zurich, is what I just heard you say. But you did your training in the US. So maybe just talk to us a bit about your training and kind of maybe how you came into medicine for a bit, and then kind of your training and your travels and everything.
Of course, of course. So thank you again. So yeah, so I'm a US trained physician. I still reside also in the US, still work in the US, and then I do have family in Switzerland. How I got into medicine, my father's a doctor, my mom's a nurse, and then I got very sick actually in my late teens, early 20s with a lot of gut problems that no one could really help me with, and people laughed at me. Even this was before medical school, chronic IBS, bloated,
Mhm.
abdominal pain, usual picture. And then finally, when I went to a functional medicine doctor who really helped me discover the root cause, that really solidified my interest also in not just in medicine, but also really to find out how to help people also long term. And hence, my journey started into integrative medicine, functional medicine, also Swiss biological medicine.
We see this a lot with our colleagues, with our friends. A lot of times the journey starts with a personal story. I also had a story like that where I saw my primary care doc had some gut issues. They put me on Nexium, one pill, like a free drug sample. And I was like, this doesn't make sense. I did a bunch of other things, functional stool testing,
Yeah.
got better. And then I was like, this integrative functional medicine seems like the way to go. So yeah, thank you so much. I'm really curious about Swiss biological medicine. There's a lot to say about that, I'm sure. So we'll have our questions after you talk about it for a little bit. I want to just talk for a brief minute about COVID-19 updates on vaccines. So basically the tri-state area here in the mid-Atlantic, the Maryland, Virginia, DC area is all kind of opening up to age 16 plus, starting in mid-April at the latest. Maryland's already open for age 16 and plus, and you see the links there, and you can go to those links if you're residing in any of those states and check that out and sign up for that. We also are having, speaking of gut, we're having a gut health group visit series with Jen and I that we're doing. We did reflux last week, and then we're going to do bloating, gas, constipation, and food sensitivities, all of which, of course, have root cause or causes. And you can sign up using the link in the chat box for that. They've been a lot of fun so far. And I know that next will be a topic that's near and dear to everyone's heart, bloating and gas. So um, we also talk about a lot about the limbic system and about how we can de-stress the nervous system. We know about the sympathetic and parasympathetic balance of the autonomic nervous system and how this can be a key to people's health and wellness, really unlocking some of the detox system, helping with brain function, of course, mitochondrial generation or ATP generation. So the nervous system and of course the gut is important. And we know that ANS balance or autonomic nervous system balance is really important for gut health as well. And certainly in this era of COVID, the immune system as well. So we started doing this for the past, I think at least 6 months now. We've been doing some virtual heart math series with our amazing instructor, Liz Reese. And we're doing this again, Wednesdays on the 14th, 28th, 21st, and 28th of April from 4 to 5:15 p.m. So you can sign up for that too. This is the intro class. We also have a kind of an alumni group visit that we're doing now for those that have gone through this 3 series already. Have you done heart math much, Daniel, or other ANS?
Yeah, absolutely. So, the autonomic nervous system in general is really key, because something that we'll also talk about here in a minute, how there's so many different triggers that really affect the
Mm,
nervous system directly.
yeah,
Of course, stress being the most common. So yes, it actually is really important.
yes. And then here's our lineup for the rest of the month. So later this month, we have Emil Clark, who is new to CIH, but he is a physical therapy assistant and certified ergonomics specialist. He's going to be talking about what's relevant, I think, for a lot of us, whether you're working at home, whether you're contributing at home, not necessarily formally working, but at home, or if you're working in a workplace, chances are you're sitting at a computer, right? So, and this is, of course, affecting, all of our nervous systems, et cetera, and our overall body. So how do we optimize ergonomics for healthy, I would say workspaces, but also living spaces as well. And then on April 22nd, which is the next Thursday after that, we have our own Dr. Alakaja, Dr. Toyin Alakaja, and Marna Regier, our nurse practitioner here, and they're going to be talking about women's health, which I know is also a big topic. And then Dr. French, who's a friend of mine from the Integrative Fellowship with Dr. Weil, is going to be talking about building resilience and how that's been really transformative in her own life and using art and music to build resilience. So we are going to be talking today with Dr. Kessler about Swiss biological medicine. And Dr. Kessler has a diverse training, including a certified functional medicine practitioner. And we kind of grew up together in a way in the IFM conferences. That's where we first met and been good friends ever since. So I think that being said, maybe Dr. Kessler, if you want to kind of go through some of the phases of Swiss biological medicine and start with that, and then we can kind of stop this screen share after that.
Sure, absolutely. So, yeah, I was very lucky to have many mentors over the years, and one of my mentors is Dr. Rao. It's what you see his name here on the screen. So he was really the founder of Swiss Biological Medicine. He's been a Swiss doctor for many years and practiced for many years at a very successful clinic in Switzerland called the Paracelsus Clinic, where they saw patients from, I think, 82 countries. So what that means is that a lot of people are suffering, not just in the US, but worldwide, from symptoms that sometimes just cannot be explained by, through traditional medicine. And what they really have found is that, to keep it simple, that there are really three pillars, so to speak, that we really look at ideally to really treat someone. So where you go to a traditional doctor and tell them maybe, that you're having some reflux, like we were talking about, and you get some Nexium. So it's more of a symptom and then pill approach directly. It's really the idea is that what is really causing these dysregulations in the body. And I know that a lot of your viewers that are listening today and also in the future on this webinar, think about if you imagine sort of a like a seesaw that has a tipping point in the middle, then you can imagine that there are things that can push you down. And then ultimately there comes a tipping point where there's just no more stability and everything breaks. And what we refer to this in medicine is we call this adaptation, right? And when you look at these pillars, then everybody has heard about toxins. Everybody knows that the immune system is 80% in your gut. And then when you look at the word regeneration or rebuilding, that just means that there has been imbalance present where at some point the body breaks and can no longer adapt. And that's when people develop symptoms. In functional medicine, we refer to this as root cause medicine. So where we have the root causes, and at the top, the leaves of the tree are sort of our symptoms. But with Swiss biological medicine, the detoxification part really plays a huge part also in the mouth. So the very, very first step that a lot of doctors really miss and not look at is actually the health of our teeth. And what's really interesting is that when I went to the clinic in Switzerland, did my training, that they have a chart that lists all the teeth and all the links to all the different organs in the body. And what Dr. Rao has taught and what I have seen with my patients, that a lot of times chronic issues that were not able to be addressed properly would not get better unless you also took care of the teeth. Case in point, for example, the front teeth, so the incisors, teeth, those are actually linked to our bladders and kidneys and also the prostate in men. So I had one man who had chronic prostate problems, chronic prostatitis, infection of the prostate, chronic, years, did not get better until the teeth were taken care of, and all of a sudden he had no more infections. And then the teeth in the back, like our molars, are linked to our small intestine primarily. So a lot of our viewers may suffer from, IBS or maybe something called small intestinal bacterial overgrowth, and we always wonder where is this really coming from. So a lot of times it's also really our teeth. And this has been proven, scientifically. So everything here is really science based. I really want to emphasize that.
Yeah, can we take a minute to take a deep dive into
Yeah.
that? I've not heard of that before, so that's great. Great. It's pretty enlightening there. So, what is the mechanism by which, let's say, the molars are associated with the small intestine and possibly can cause SIBO or the front
Well,
teeth?
yeah, of course, well, so ultimately, everybody has heard the keyword inflammation before. And so doctors can actually measure inflammation markers and
Mhm.
also, autoimmune markers. And I remember, I'll tell you a quick story. I had one patient many years ago, a woman who had a positive autoimmune markers called an ANA. Beautiful woman, right? Beautiful teeth. And I said, why in the world would she be having, these autoimmune markers off? And then in one of my follow-up visits, I did a more detailed examination, and her back tooth, her back molar was actually rotting and had horrible cavities. And you didn't see it. She had a beautiful smile, but unless you
Mhm.
actually really looked deep in there. And I said, you may want to take care of that. And lo and behold, once the tooth was taken care of and we supported her with some of the things I'm sure you also do in your clinic, through diet and some supplements and whatnot to support the gut health, actually her immune markers actually normalized again, which was amazing.
Yeah, and of course we know. Thank you, and we know that certainly inflammation of the gums and of infection of the teeth can lead to intestinal permeability, leaky gut, things like
Yeah,
that. So there's definitely some link
yeah,
there. Yeah.
yeah. And then I had a recent patient who had recurrent styes on the eyelid, and I happened to ask him, have you ever had any root canal issues with your fourth tooth, your canines? So these are linked immunologically to your eyes. They're also called eye teeth, you know. And he said, yeah,
Oh,
how did you know? And I said, well, I had a good teacher
yeah.
and who taught me these things. And then, so what do you do about it? So one of the questions here in your chat is, if teeth are an important factor, then how do we rely on just dentists to link our teeth to other health issues? Well, the issue is that not everybody addresses it, number one. And there are also, it's called biological dentists, and they are found in most cities,
Hmm.
that specialize and have this extra training, that know what else to do besides pulling a tooth or putting a crown on it, and that itself can also cause huge issues.
Yes, and we have certain dentists that we would recommend in our area for sure that are biologically trained, especially by the AIOMT, I believe is what it's called.
Yeah,
Yes, and so yeah, definitely, ideally, the dentist that you see, Mustafa, will have that knowledge or at least that awareness of the connection between oral
yeah,
health and the rest of the body, because
yeah,
obviously we know the body is connected, and like
yeah,
that, unfortunately, not everyone is
yeah,
looking at that connection, but
yeah.
thank you for showing me there.
And then ultimately, so the way to keep it simple, because I know I see some other questions here now about Mercury. So what they do, what the clinic does in Switzerland, and also, what I have done with my patients, is that ultimately we want to know two things. Number one, what is really the burden on our body from various stressors? Remember that seesaw. So
Hmm.
what is really pushing the body down? And the other thing is, what are we doing to also support it? Because everybody wants to be balanced.
Hmm.
So when you think about balance, it's really what needs to be removed and what needs to be given. So a lot of people always focus on remove, remove, remove,
Yeah.
but they don't focus on rebuilding. And that's why the third pillar here is also so important, to rebuild. Because if you just say, for example, Kiana Lee put here says, well, what about mercury fillings? So if people just take out the fillings immediately without really preparing the gut to handle that extra toxic load, you can get really, really, really sick. It's happened to a friend of mine who is a very, very smart doctor. He had all of his mercury fillings removed at the same time, ended up in the hospital with horrible, proven, not just woo woo, right? Proven mercury toxicity
Oh,
from that, so which was
yeah.
which was crazy.
Yeah, so having it done in a gradual manner to facilitate detox and or kind of rebuilding
Yeah,
up the gut so that it can handle the increased toxic load from the mercury removal.
yeah,
But I agree with what you said there with Kiana's comment. certainly that would be something that we would typically recommend you go to a biological dentist to get that really and truly evaluated, because
Yeah,
there are
yeah,
definitely some things there that
yeah,
if it's in
yeah,
there and that's part of the toxic load, that might be contributing to chronic
yeah.
inflammation.
And the key thing is, so whoever, your community ends up working with, it really always needs to be a team approach. My parents, for many, many years now, they're in their late 70s. They had a leading clinic in northern Germany. They had 25 nurses at the heyday,
Mhm.
which was amazing because we really discovered so many things about each patient. But then we put also a plan into action that people could follow, not just here, take this antibiotic, or here, take this supplement. It was very logically, addressed. So when you look at now these three pillars, then Swiss biologic medicine in a nutshell is really about helping your body to regulate better, right?
Yeah.
So that's really important. So what does your body need to regulate the systems better? So if somebody has, heart problems, or if they have, constipation, why is this really happening? You mentioned heart now, so all these things really work in synergy.
And
That's
and
really
of
what
course the
happens.
body, I agree with that. And the body really is trying to get back to homeostasis because the body's always trying to heal itself. So if you can get that back to that balance point, right? Isn't that true? The body will basically start to
Yeah,
heal at that point.
yeah, yeah. And then one thing I want to mention here really quick, this is the only sort of complicated thing I'll mention, but if you guys can follow me for a second. So the process with Swiss biologic medicine is, that there are 6 key steps. The first thing is that we are exposed to a trigger, to a toxin, to an infection, you name it. And our body's first response is to eliminate that. Case in point, if somebody has food poisoning, everybody's been through that before. First step is diarrhea. So what we tell patients is, do not take Imodium,
Hmm.
because you need to allow the body to get rid of it. Now, if you take Imodium, the toxin stays in your body. Now, what if somebody is exposed to a toxin and they cannot eliminate properly? So how many people are constipated, right? Or how many people cannot sweat properly?
Hmm.
How many people
Yeah.
cannot breathe properly? Those are ways to eliminate. What happens then is that the body actually then deposits that toxin into the tissues if it cannot eliminate it. So that's step number 2, is, you know um, deposition. And then as this process goes on, it then can lead to degeneration. We call it impregnation, almost like being pregnant with the toxin.
Hmm.
Then you go through different phases where then the tissue degenerates. So now we have proof on X-rays, or now we have some blood numbers that are abnormal. Now the tissues are degenerating, like thyroid. You have now evidence of autoimmune thyroid. And eventually, ultimately, sadly, the last one is cancer, where the tissue is so bad. So the goal is, by removing it, how can you pull these toxins out of your body, um, and then actually support your body to eliminate. And that's why we focus on diet, we focus on stress relief, we focus on maybe some supplements to help, with the proper elimination. So that's really the essence of, easy to understand, with the Swiss biological medicine.
Great. So another dental question, I think, if you can see it on there from Christine. What about wisdom teeth? Are they important
Ye-
or
Yeah, so I still have my wisdom teeth. Um,
good for you?
yeah, yeah, I was. Have I always gone to the dentist the way I should have? No, I did not, unfortunately, but now I'm getting better over the years, of course. But I think that, I mean, this is a topic for another day, but I will tell you that, one of the key, I'm just going to mention a name here, Dr. Weston Price.
Hmm. Yeah.
He was a dentist who traveled all over the world and studied the different teeth from different cultures, based on their diet sources and whatnot. And what they found was that later, when he revisited, certain cultures, that the teeth had changed in the structures and the mandibles and everything based on once sugar was introduced. So, and everybody knows how poor the diet is in the United States for various reasons. And ultimately that impacts the strength and structure, how our teeth, develop. And ultimately people have pain. And then, what does the dentist do? Well, they know how to pull teeth,
Yeah.
and sometimes it is important, um, for them to be pulled. But then there are also, maybe some of your viewers have not heard this before, there are, muscular skeletal dentists, TMJ specialists, and there's so many things now you can do for proper oral health, besides pulling teeth, or putting crowns. So that's why a good first step would be to have a team approach, have a biological dentist, work with them, and get a fresh idea on what else you can do. And then work with someone like you or someone like me, as a team approach long term.
Yeah.
That's really the best step.
So what I'm getting so far from Swiss biological medicine is kind of looking at these three pillars, Dr. Rao's three pillars. We have the detox system, both in terms of looking at toxic load as well as the body's ability to excrete the toxins, sort of like the ability to deal with it and restore homeostasis. We also have step two on improving the intestinal microbiome and certainly gut health, of course. And we know, like you said, Dr. Kessler, that not 80% of at least 80% of the immune system lies in the gut, right? And then
Yeah.
the step three of restoring and repairing the tissues, kind of rebuilding the body in a way.
Yeah.
What other aspects of detox do you think are helpful? Are you a fan of sauna, or what kind of things are you talking about for detox?
Yeah. I think that everybody always thinks about like environmental toxins. So just for your viewers to know, I was very privileged to work at the CDC,
Mm-hmm.
the Center for Disease Control, and the National Center for Environmental Health. So I
Okay.
know firsthand how toxic our world is, and they even publish this public knowledge. They even find toxins in babies' cord blood, which is horrible.
Mm-hmm. Yeah.
But the other toxin is actually toxic thoughts, right?
Mm-hmm.
Sometimes we are our own worst enemies,
Yeah.
when it comes to that. So I think detoxing is also really, especially right now with COVID.
Mm.
One of your questions I think we talked about was how can we build resilience, and I know you have another speaker coming up later who's going to talk about building resilience. But I think a takeaway for your viewers that I always have done with my patients is really important. There are only three sources of stress in people's lives. Three: relationships, money, and work. And if you write down on a paper how your relationships have been affected, how your work has been affected, how money has been affected, also from COVID, then everybody can agree that we feel uncomfortable
Mm.
because of those stressors.
Mm.
And then how do we deal when we feel uncomfortable? We use something to deal with that feeling, and that's oftentimes comfort foods,
Mm.
for example, and everybody knows that, right? So the ice cream runs, or the beer, the alcohol,
Yeah.
sugary drinks, like things that make us feel good for the moment. And then we feel guilty, which goes back to our toxic thoughts.
Yeah.
So how can you build really resilience? It's also by being aware why we should eat better, not just say, hey, you should eat
So if you're
paleo
eating that ice
or
cream or that beer, then just enjoy it, right? Because then that's gonna make it more autotoxic, right? With that,
I
the
think there
sugar.
has to be a balance,
Yeah.
obviously, right? But the key thing is really that we do things for certain triggers we were exposed to, and then we feel guilty about them later on, and we still do them. So it's kind of a catch-22.
Yeah. Yeah.
And then we do some testing for the gut health, and we say, oh, you have 1,000 food sensitivities. I wonder why that is.
Uh-huh.
Well, because maybe you should do heart math,
Mm-hmm. Yeah.
address your stressors, because they haven't really been addressed, rather than
I,
not just
I
taking,
wanna
you
bring
know.
up something I was listening today on the way to work. A podcast I was listening to. I was listening to a aromatherapist, and she said that when the body is under stress and the parasympathetics cannot be activated, right? It's basically a sympathetic dominant state. Then the body cannot detox. The cells don't feel safe enough to start releasing the toxins. What are
Yes,
your feelings about that?
absolutely. One of the little things that your viewers can also do one thing I do in the clinic is a very simple test to see if your parasympathetic actually works, is the gag reflex, you
Mm.
know? So many people I've seen with constipation, chronic constipation, they don't have a gag reflex. And the reason why that is so important is that we have a nerve called the vagus nerve, our biggest nerve in our body, that supplies the muscles into our gut.
Mm.
Think about a tube, that's interlaced, with nerves. So, and if you're constipated, remember, you're not eliminating.
Right.
And ultimately what happens, and you and I know, but for your viewers, what happens is that the toxins, they go back to your liver. So your liver is like the ultimate filter, just like your spleen. And people's liver gets messed up and fatty liver, et cetera, all these things. But the key thing is you're not eliminating. And when you're not eliminating, then the toxins they will become deposited,
Mm.
impregnated,
Mm-hmm.
your tissues degenerate,
Mm-hmm.
et cetera, right?
Right.
So that's why doctors always say everything starts with the gut. That's
Right.
why everybody in functional medicine, integrative medicine, Swiss biologic medicine, we focus really on the gut, because once you get the gut moving, a lot of things get better. It doesn't have to be a crazy expensive treatment,
Yeah.
simple solutions.
Yeah. Great. And then for the gut, what are your thoughts, or what are Swiss biological medicine thoughts about gut health? What's the best way to support the gut?
Yeah, so I will tell you that from my experience, so I've been a doctor now almost 20 years. And then Dr. Rao is now in his 70s, so he's been a doctor even longer. I will tell you that, so vegetarian diet in general, not to eliminate meat completely, but really, I like to call it common sense diet. So really put color in your diet.
Mm-hmm.
Ask
Rainbow,
yourself,
rainbow diet.
yeah, ask yourself, and just be honest. I always tell my patients, cut the BS. Are you really truly eating well? Are you really following a good practice? I don't like to say, hey, you should do this or should do that.
Right. Right.
And, cut the BS. What are you doing? When I was sick, I told you in my late teens and early 20s, I drank 15 Pepsis a day. Crazy. I would never do that anymore these days. So, um, but color, right? So, and you mentioned rainbow. Rainbow has 7 colors, right? Red, orange, yellow, blue, green, red, orange, yellow, blue, green,
Indigo.
indigo, violet,
Indigo violet. Yeah. Yeah.
and there are 7 days of the week, right? So some patients say, hey, Mondays is my red day, or Tuesdays
Oh,
is
oh,
my
that's
orange
interesting.
day, right?
Yeah. Yeah.
And oh yeah, that's easy. Or I have some patients in their pantry have, some jars with different colored foods, and say make sure that every day you put all the colors, on your plate, for example.
Uh-huh.
Um, right? So easy solution, and makes it fun. Also, if you have children,
Yeah.
let them,
Yeah,
um,
yeah, I think yeah, that's Kiana wrote a joke on there. Yeah, Lucky Charms doesn't count, right? Don't make sure the rainbow doesn't include food coloring.
that's right,
And
that's
we know
right,
about
that's
the
right.
jokes about vegetarian versus carbitarian, right? I mean,
But here is one thing I really want you to pay attention to, and your listeners. So if there's one thing I really want you to get from Swiss biological medicine. So there have been research that was published also by the clinic. So the last pillar is regeneration. And so every organ has the ability to regenerate. Some
mhm,
organs can do it quickly, and some organs will take longer. So bones takes the longest, takes years.
mhm,
So if you have, for example, heavy metals like lead and those things that deposit, it takes years to get that out. But the gut has the ability to regenerate within about 7 days to 3 weeks, right?
nice.
So that's why you may have heard other practitioners do their little detox program, which is like 21-day detox. The reason why is because people know that the gut can regenerate. So every day they regenerate. So if you really do start a nice little detox where you get rid of all the junk,
Hmm.
um, and then you may eventually get a little bit worse initially. People may get more body aches
Yeah,
or
the Herc reaction.
rashes
Yeah,
or
yeah.
joint aches, get all this. I'm going to use the word crap first, get all this crap out of your system, right?
Hmm.
Um, all of a sudden they say, oh my gosh, my skin looks better, I feel
Yeah.
better, I'm more clear. And you always hear that, so that's really key.
What do you think about when people lose weight? Are they releasing fat stored toxins? Like how should people just not lose weight that quickly and just be more gradual about it? What do you think about that? Right? Because that's also part of the, of course, everyone wants to lose weight, everyone wants to look good for summer, etc. And there's
Yeah,
all these programs that are like lose X number of pounds in 30 days or something. But there's also this issue of detoxification,
yeah,
when releasing toxins from the fat.
absolutely. Yeah. So most toxins are fat soluble, which means that your liver has to help these fats to attach little chemicals so you can pee it out, for the sake of understanding. That's what the job for the liver is. But yeah, yeah. So the first thing is really, one of my other mentors said, first get healthy and then lose the weight. So get your gut ready to
Hmm.
handle all the influx. That's why people get this brain fog, or they get, withdrawal symptoms. And we've all been there,
Yeah.
because again, it's sugar's like cocaine. Like, you got
Yeah.
to have that fix.
I think it's
Um,
considered stronger than cocaine. It's more addictive than cocaine based on.
Yeah, yeah, yeah. There was a study one time where they, had these two drinks, and nobody knew. Well, the people who did the study, they knew which one was which, but the same area in the brain for addiction lit up, both for
Hmm.
sugar and
Lit up.
also,
Yeah.
yeah, yeah, yeah. So that's why you start with those pillars. You
Yeah.
really start with gut health, teeth. Make sure you address that properly, and
And
then
how do you, but before we get to the questions, just to look at that third pillar, how do you rebuild the tissues? What's kind of that third pillar of Dr. Rao's discussion?
yeah, yeah, yeah. So I think that everybody knows that the body has this wonderful innate ability to heal. You always hear that. It's not, there's nothing, I always say voodoo. There's nothing voodoo about it. You've heard that, and some people say, oh, there's like a spontaneous remission that
Hmm.
the person, you know what, if you want to call it that, that's
I mean,
fine.
but that's even if someone gets a hip surgery, they're post-op, right?
Yeah.
Their tissues are healing, or they have a wound
Yeah,
that.
yeah, I will tell you. So to not to make it more complicated, but you mentioned heart math. There's another item that I'm sure you have heard of. It's called electromagnetic field therapy,
Hmm.
or I'm sorry, pulsed electromagnetic field therapy,
Yeah, like the
PE,
McMakin, like PEMF, and then there's also
PMF.
specific microcurrent as well.
But one of my friends' daughter had to have hip surgery,
Hmm.
um, and then we had this device, which there's like many on the market, but we used it, every day on her. It's like a little mat you can sleep
Actually,
on.
which one, can I ask you which one that you used for that?
So that one was the Beamer.
Beamer,
you
yeah,
know
yeah. We've used that here in our clinic. Yeah, yeah.
yeah, so Beamer's one, and then my parents in Germany, they used one called OndaMed. Onda, it's ONDAMED. It's a little bit
Okay,
more sophisticated than the
okay.
Beamer. But anyways, but the point was that the orthopedists themselves said, wow, I've never seen anybody heal this quickly after a surgery before,
Yeah,
and even like, NASA and other organizations use it,
yeah.
for those type. So that's one option. And then I will tell you that there are nowadays, there are people that use certain types of injections, like peptide therapy, those
Hmm.
types of things that we don't have to get into. But
Right.
that there are other ways to help, support the body regenerate. But ultimately, bottom line is, take away what the body doesn't need, give the body what it needs. And I've seen this so many times. Speaking of regeneration, I'll give you one quick example. Hair loss, right?
Hmm.
Or people with eczema or psoriasis, um, this so skin regeneration, right? Brittle nails, right? I mean, how many people complain of that all the time? And I've had patients where I had a kid with severe eczema that nobody could help. I had a patient with chronic psoriasis for 2 years.
Hmm.
Nobody could help. And make a long story short, within 6 months, beautiful skin, right?
Yeah.
Without steroids, right?
So the main intervention was what?
The intervention was applying the three pillars,
Okay.
finding out, because your skin
Yeah.
develops the same way like the gut. I know you know that, but a lot of your viewers don't know that.
Yeah.
And so I asked the guy with psoriasis, for example, would you like to get better? He said, of course. I said, would you do whatever it takes? He says, of course. I said,
Yeah.
well, got to fix your teeth. You have horrible teeth. And this guy was on the verge of being homeless. Guess what? He did it. He found somebody to take care of his teeth, get rid of all this inflammation.
Uh-huh.
He had a vegetarian diet. I gave him some supplements also. And I said, take pictures because you're not going to believe it.
That's
Six,
amazing. Yeah.
6 months later, he came back and said, Dr. Kessler, I can't believe it. You know?
Yeah. 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 Going from
So
the
so
same
that's how
person.
the
Great.
that's how the skin, so you heal from the inside out, you
Yes.
know?
Jen has a question, or this is a great question here. Recommendation for working with gut-brain connection and favorite nerve exercises for other than the gag reflex to help with rebuilding the vagus nerve.
Yeah, so the easy one is gargling, right? So one of my neurology friends, also taught me that. So gargling, every day, that's how you really work out the nerves.
Mm-hmm.
Gargling so loud that the neighbors can hear it.
This is the time, Daniel, where you break out into the song. That there's some chanting right now.
Yeah, yeah. So that, and then, yeah, and of course, chanting, those types of things, right? So anything really that can help, with that vagus nerve.
Mm-hmm. Mm-hmm.
So that's really key because that really stimulates not just your vagus nerve, but also the digestive muscles here and whatnot. So, and I've had many patients with chronic constipation. Once their gag reflex came back, eventually, they all their their SIBO, their small intestinal bacterial overgrowth, all those things eventually get better.
Yes, I was reading on the Paracelsus website about, I think there's homeopathy, and we don't necessarily, or I don't know a ton about it at this point. What is the, where do you use that? How to use homeopathy?
Yeah, so I will tell you, so I am not a homeopath, right? But I do have training in using some of these substances.
Hmm.
And some people are going to be listening and or other doctors may say, oh, we don't believe in that. And how can something like that even
Hmm.
work? It's okay, if you have those feelings. But I will tell you that ultimately, it's all about regulation. And if you have imbalanced tissues, for the reasons we mentioned, like um, like the toxins that have built up over time, and we deal with our chronic stress, and our nervous system is messed up, all these things. Then there are key interventions through some of those remedies. There are even some, it's called German biologic type medicines, which also rely on what's called spagyric medicine and homeopathic remedies, those
Okay.
things that are very, very easily tolerated because a lot of your patients may also have a lot of sensitivities to certain supplements and whatnot. And then a lot of these are sublingual, they go under the tongue. And as your body rebalances, people just feel better. I've done this with thousands of patients. It's just really, really amazing.
Okay, great. Thank you. And then because we're, obviously in a pandemic, I need to ask you about how Swiss biologic medicine deals with the immune system, building up the immune system and, addressing COVID-19.
Sure. I think that so let's give some key action steps, for your community. Um, so got to start with the guts, and so you got to make sure that you're eating well, get your colors in there,
Hmm.
because the more sugar we eat, it's going to cause more inflammation. Nobody really knows yet long-term effects of COVID. There are some studies coming out how it affects, the body, the brain, the thyroid, all these things are coming out. So have common sense, start with common sense. The second step is you have to go day by day. You
Hmm.
know, um, one of my mentors told me that anxiety is a symptom of the future. Depression is a symptom of the past.
Hmm.
So really just go one day by day. Nobody knows what's going to happen. If you
Yeah.
asked me a year ago, 2 years ago, this would happen, would it be the pandemic? Nobody would have believed us, nobody. So are you really doing, and everybody, has 24 hours in a day. So do the best you can with those 24 hours. There's no special time. We all have lifetime. There's no other time but lifetime. And then there are some supplements. I know you talk about it, like vitamin D and those things. And vitamin D deficiency is so common. worldwide. And from a mechanism standpoint, vitamin D actually strengthens macrophages, which are white blood cells in our body.
Mm-hmm.
And a lot of times when you deal with chronic viral infections, that's why people give vitamin D doses for the flu and for the common cold and viruses in general. And my vitamin D level used to be 12. Now it is in the 70 range, and I just can't remember last time I got sick. I mean,
Yeah.
even with a cold, even before COVID, I just don't remember. But look at it as a puzzle piece. So don't just say, "Oh, this is the absolute treatment for COVID," or you can never say that. You
Mm-hmm.
know, you really have to support each body pillar, each body part, like a puzzle. And I guess to also explain it, it's like a puzzle, like a picture. And I tell my patients, how do you start to solve a puzzle? You don't start with the middle. You start with the foundation, right? The edges. So are you sleeping well? Are you eating well? How are your relationships? How's your work? How's your money situation we talked about? Are those taken care of? Are your needs met? And then where you and I come in, then we individualize that and say, okay, how does the rest of your picture look? How does your heart math look? How does your gut panel look?
Microbiome for sure. Yeah.
Yeah,
Yeah.
and then you say, hey, Andrew, you need this and this and this because of X, Y, Z. That's how you
Right.
individualize it.
More precision. Right. Right.
Yeah, yeah,
Yeah. And then also the mindset. I mean, just having this mindset of gratitude that we're here and working with the breathing, all of this, so it will really be helpful. Kiana was mentioning there's a really good homeopath locally, Raquel Rosas in Frederick. I've never heard of her, but thank you, Kiana, for the recommendation. That would be really cool to we'll try to reach out to her to talk more about homeopathy. So yeah, maybe we'll have her on even. But what is your thought on let me just go back to the questions. I think oh okay, so we could talk about yeah, so adrenals, like we can talk about adrenal glands, right? How are the adrenals important in health and in the Swiss biologic medicine? How do you address sort of supporting the adrenals?
yeah. So basically, for your viewers, so the adrenal glands are little almond-shaped glands, that secrete hormones. They're on top of the kidney. We each have two. And they have, think of it like an onion. So they have three layers, like an onion. One layer is responsible for blood pressure hormones. One layer is responsible for sugar hormones, stress hormones, like cortisol. And one layer is responsible for sex hormones. So if you have a patient that suffers from low blood pressure or high blood pressure, they will
Mm,
have adrenal dysfunction. If you have a patient that suffers from blood sugar dysregulation, hypoglycemia, or they are a diabetic, they will have adrenal dysfunction. If you have a patient who suffers from low libido, low desire, sexual dysfunction, etc., that's the third layer. I was always taught the deeper you go, the sweeter it gets, right? So you go from salt, sugar, sex.
uh-huh.
So,
Oh, I
so a
like
very, so yeah, so that's easy to remember for your
yeah.
viewers. So if you ask yourself, do I crave salt? Do I crave sugar? Do I suffer from low blood sugar? Do I feel had brain fog or dizziness or sweaty and I eat something, I feel better? They have adrenal
Low blood
dysfunction.
sugar. Yeah.
Yeah. Or how's my sex life? Am I still interested? Do I want to be like this with my partner, stay away from me? Or, is there another reason why we're not connecting more on like an
So you're
emotional
saying
level?
salt, sugar, sex. So it starts with the salt craving, and that's the where it starts. And then if it goes
Yeah.
deeper into the hypo or
Exa-
hyperglycemia or libido issues, then it becomes like more severe.
Yeah, because then you talk about estrogen, testosterone, those
Oh,
types
okay.
of
Got it.
things.
Got it. That makes sense.
And then the reason for that is, remember we talked about toxins, and you and I know this. So environmental toxins are hormone disruptors, or they're
Yes.
called
Endocrine
endocrine
disruptor.
disruptors.
Right. Right. Right.
So, and a lot of times, when you ask somebody, hey, how about salt, sugar, and sex? If all three layers are affected, a lot of times that's a little clue.
Mm.
Maybe environmentally there could be something going on as
Environmental
well.
toxicity now is huge. I mean, that's I think
Yeah,
a big part of what I think we
yeah,
feel like we're cluttered through
yeah.
here. Yeah.
But simple interventions, people can measure their blood pressure. I think a good blood pressure is 120 over 80,
Yeah.
which is decent. if you are really low, add some salt to your diet.
Mm-hmm.
You know, if you feel that your blood sugar is off, the very simple trick that will fix everybody's low blood sugar forever, is really fats. You know, so simple tablespoons of olive oil or avocado oil 3-4 times a day,
Mm-hmm.
your sugar is going to be stable. There should be no issues. You know, I found that true to be
That's great. Yeah, it's a
with
great
thousands of
tip.
patients. Yeah.
Yeah, that's a great tip.
And then
Um,
of course, sex wise, you know, hormone wise, there are sometimes, you know, hormones we have to give, but I found over the years that hormones are messengers of something else that's really triggering the imbalance. So that's
okay.
where all the other stuff comes
The
in.
root cause. Thank you. Thanks, Daniel. And then, of course, we have a lot of people here with thyroid issues. That's probably the number one thing we treat is actually hypothyroidism. How would you approach that, or how would Swiss biologic medicine approach that?
Yeah, yeah. So again, very simple. You know, you always apply the 3 pillars. Remember that lady we talked about earlier in the beginning, that beautiful lady with a rotten tooth.
Hmm.
So she had Hashimoto
Hmm.
thyroiditis.
And sorry, just to go
Um,
back to the 3 pillars. So you start with detox in the Swiss biologic. That's
yeah,
where you start,
yeah. So
right?
so everybody, so everybody I see, I look at their teeth.
Hmm. Yeah.
I take a detailed tooth history.
Okay.
I make sure that if they have cavities, old root canals, etc., that they work with a biological dentist.
Hmm.
And then I work, you know, on their gut health primarily. I identify, you know, imbalances with testing,
Hmm.
and then help them, you know, regenerate. That's really the key, right? Because
Yeah.
otherwise, with a thyroid, everybody's asking for armored thyroid or
Hmm.
T3, etc. It really doesn't address the root cause.
Right, right. That's true. So yeah, so you were saying you had the lady with the root canals, and did her thyroid get better too, or
Yeah. So she also was found to be gluten sensitive on top
okay,
of that.
right,
And then once we got that out of her diet, her antibody levels actually dropped down, and then eventually they were no longer positive. So
yeah,
it took about, I think with her it took about I think 9 months, something like that.
yeah, yeah. It takes a while, and we know there's that molecular mimicry between gluten and the thyroid, so that we see a lot too. And of course, we do see a lot of SIBO here, small intestinal bacterial overgrowth.
Oh yeah, oh yeah.
Would you say that's a detox issue as well? I mean, we know it's a gut issue. Where do toxins play a role in that?
Yeah, so with SIBO, specifically, think about, you know, I was always taught that 1/3 of people get better permanently,
Hmm.
and 2/3 of people can have recurrence, because you always have to address why this is happening.
Right.
You know, so if somebody is constipated, they cannot eliminate, then the bacteria will translocate from
Yep.
large intestine into small intestine.
Yep.
If somebody has a bad molar that
Mm.
never has been addressed, you know, that could be a reason. Maybe somebody has a bad gag reflex, that is, there's no nerve innervation, you know.
Okay.
So you see, so there are all, and
Yeah.
some people have all three.
Yeah.
So that's how you do
And
them.
they have low thyroid. That's
And low thyroid on top of that, right? It's like a Pandora's box, you
surgical
know?
scars too. Like there's all these different things.
Yeah,
Okay, this is good from Karen. I think why does consuming tablespoons of olive oil help control blood sugar?
great question. So there are two hormones in our body that regulate really blood sugar. One of them is cortisol, and which is a stress hormone, also another hormone called glucagon. But the response to high blood sugar is insulin. So if you eat, one of the guys here said carbitarian. I like that. So if you eat a lot of carbs in the form of, so carbs or sugar, then
Mhm.
your body will produce more insulin and you
Mhm.
bottom out, you know?
Mhm.
Now, if you eat protein, also your insulin levels will go up as a response to that. But when you eat fat in the form of good fat, your insulin levels are flat, you know, for the most part.
Yeah.
And that's the key finding. And I will tell you that, um, gosh, thousands of my patients over the years had, you know, low blood sugar reactions. They had no idea. They went to all these doctors, and I didn't start with, "Hey, you have mercury poisoning." I said, "How are you doing with salt and sugar? And that, why don't we fix that?" You know, and all their symptoms went away. You know, it's a beautiful little intervention.
Yeah, I think what also she's saying is that so yeah, definitely controlling that insulin spike. It would be independent of sugar intake because basically your body is always trying to keep blood sugar regulated so that the critical organs like the heart, the brain, etc., have enough blood glucose in the system, even if someone's fasting or basically someone eating a non-insulin generating food like fats. So,
Right,
so you don't
right.
have to eat sugar in order to keep the blood sugar up. Your
No,
body
no.
will secrete hormones that will release glycogen, let's say, from the liver to
Yeah,
convert it to glucose so that you keep that blood sugar up, even if
yeah. It's
you're
always about the adaptation,
yeah,
and I guess so. I guess that looks like we're almost out of time
yeah,
here, but I think though, I think if it's okay, so the key takeaways
yeah,
that I wanted there are three key takeaways if you guys want to take some notes. Um, so Andrew and I, we've known each other for a long time, and we always were taught about other three pillars. So a lot of doctors use these three pillars, but stress is really number one. So write down on your papers your relationships, what's going on, your work. Are you grateful to have a job? Are you grateful to have money? Are you grateful to have a good relationship? If you're imbalanced in those areas, no pill is going to fix that. So make sure you do that. um, Another doctor said you can eat all the broccoli in the world. If you don't forgive, the broccoli is not going to help.
yeah. I love that.
So,
I totally agree with that.
and because then the next step that also your patients can do is then do a heart math analysis
Yeah.
and see where your parasympathetic sympathetic system is messed up and imbalanced. And then you want to apply the three pillars. So look at your teeth, you know, take care of your oral health, make sure you're hydrated, eat slowly, chew your food well, make
Uh-huh.
sure you have a good gag reflex, right? Um, and then with your guts, here the key word is common sense and cut the BS. Are you really eating well? Or are you indulging a little bit too much in certain things because you feel uncomfortable?
Uh-huh.
So here focus on the rainbow diet. Just put color in your food.
Okay.
80% plant-based. And then as you do that, your body will already start to regenerate.
Yeah, yeah. And then the third pillar is the rebuild. Oh, that's what you're talking about. So the regeneration will
The
just start
regeneration,
happening.
yeah. And then of course, you cannot do this yourself. You need to have a team behind you that helps you, like Dr. Wong or myself or others out there that really have dedicated their lives, to help people like you that are suffering needlessly. And
Yeah, I mean,
also,
and of course, as we know,
you
as
know,
as I think we both have this philosophy, is as people get better, they don't need us as much. It's sort of like their body starts to maintain and kind of create that homeostasis automatically, which is beautiful to see.
yeah, yeah. And then I guess the last one to sum it up, remove what's bad and give what's good. So
Yeah.
that's really to sum it up.
So good. Let's see. Let's say good inputs and eliminate. Yeah, basically put good stuff in. I love that. Put good stuff in and then detox things that you don't need. Essentially, they're not serving you. So yeah. Thank you so much, Daniel. Thank you so much, Dr. Kessler. So good to see you. We'll catch up again soon.
That sounds good.
On and we'll talk to you later. Have a great week there, and have a great week, everyone. And we'll
Thank
see
you so
you
much.
Thursday. Thank you so much. Thanks, Daniel.
Bye. Bye.